Thanks for joining us for 5 on 5. I'm Joe Sullivan. Pleased to be joined by Dr. Christa Jones. Dr. Jones is the OHA Behavioral Health Deputy Director. Thanks for your time.
Thank you so much for having me.
Now, how does 988 Oregon work?
Well, 988 Oregon is a free resource that connects people to local confidential professionals who are highly trained and skilled in offering support via phone or via chat or via text. And they offer support to folks who call in or who text who are having any sort of struggle that is named by the person. So it doesn't matter what it is, if it's big or if it's small, that individual can make that call or do that text and get the support that they need. 988 is 24/7. It's also available 7 days a week, 365 days a year. And what we really want folks to know about 988 Oregon is that it doesn't really matter what your issue is. If you're stressed out, if you're overwhelmed, if you're feeling a lot of worry, say that you have a fight with your, family member or a friend, or you're having trouble at work or financial stress, anything that you need support for, that you need a really friendly, warm ear to talk to, that's a reason to call at 988.
What's the goal of 988?
The goal of 988 is to help as many people as possible. We know that everyday struggles can be overwhelming. They can make us feel depressed or sad or down. And so we want to make sure that a really high quality support and resource is available to everyone who lives in Oregon.
Now, what kind of help can I get from 988?
You can get lots of help from 988. As I mentioned before, you're going to be greeted by someone who has a lot of training and skill in helping people through their problems and connecting them to resources. There are specialized resources such as services or the call can be in Spanish. It can be in American Sign Language. We have specific numbers for veterans who need support. But mainly, it's about engaging with someone who you can form a connection with and who can also help you connect to longer term resources in your community. At times, during that call, you might identify that you need someone actually there physically with you. So you might ask for that if you make the call to 988. Or they might identify that that's needed if there are some safety concerns. And so another service that 988 offers is a connection to another professional or a group of professionals who can come to you. But most of the time, actually 98% of the time, the intervention of just making that call and getting that support on the phone or in text is what is needed, and no in-person support is required.
Why did Oregon launch the Connect to Hope campaign?
Well, 988 actually started in July of 2022, but what we realize is even in 2025, not everybody knows about this resource or knows exactly how to use it. And so we received some federal funding with special thanks to Senators Merkley and Wyden. And because of that funding, we were able to launch our campaign in Oregon. And so with the Oregon Health Authority, we developed the 988 Oregon Connect to Hope campaign. And we used a community-led approach, which means that we brought a lot of people together. We asked them a lot of questions about how do we maximize this funding and how do we make the best use of this campaign to really reach all of the individuals that we want. And so our campaign is really informed by what they had to share with us. And so you can maybe see 988 Connect to Hope on billboards, on bus ads, or even on commercials in TV stations. And so we really want to get the word out there. And so if you have any more information, if you need any more information, pardon me, about the campaign, about 988 itself, you can go to 988oregon.org.
All right, we're going to take a quick break and be right back with part 2 of our 5 on 5. Stay with us. Welcome back to part 2 of our 5 on 5 with Dr. Christa Jones. We're talking about 988 Oregon. And when should I call 911 instead of 988?
That is a really great question. And so I want to explain a little bit about the difference between 911 and 988. They're both emergency services, but 911, which has been around for a very long time, is really geared toward, law enforcement response, public safety, or medical, or fire. 988, on the other hand, is really specific for behavioral health. And so that means any mental health or substance use challenges that you might have. And so we wanted to make it as, catchy as possible, since we're all familiar with 911. 988 was a really good choice to make it easy to remember. So you can just dial that up or text text that number and you're going to get connected to a behavioral health professional. I do want to say, however, that if you or someone you know or someone that you're with is experiencing an overdose, 911 is actually a good resource to call because of the emergency services, the medical services they can provide.
Now, can I call 988 for someone else?
Absolutely. And a lot of people do. A lot of people call because they might be seeing something on the street as they're going about their day and they're concerned about someone. Or maybe there's a family member that you're concerned about. You haven't heard from them in a while. Or they're telling you that how sad they are or how depressed they are. Maybe that they're going to hurt themselves or thinking about hurting someone else. And so you can call about yourself. You can call about friends, family, and even people in your immediate environment.
We have about a minute left. Is there anything else you'd like our viewers to know about?
We would love for people to use 988 when they are feeling any sort of thought or feeling, or if they're behaving in ways that they just know that they need additional support. It is a free resource. There is going to be warmth, kindness, dignity, and respect on the other end of that call or on that text. And we just want you to know that we are here for you. So please use 988. You can call, text, or chat.
Dr. Jones, thanks for letting us know more about 988 Oregon.
Thank you.
Stay with us. We'll be right back with more local news.